Welcome to our channel. Today we're discussing an important topic that every woman should be aware of. 7 signs on your breasts that you should not ignore. We're talking about breast health, and it's something we should all be proactive about. Just like we check our skin for anything unusual, we need to pay attention to our breasts too. It's easy to brush off a little change or think it's nothing, but trust me, early detection is key. So let's dive in and empower ourselves with knowledge. First things first, ladies. Regular self-examinations are crucial. I know it might seem like a chore, but believe me, it's worth it. You want to get to know your breasts really well. What feels normal for you? The best time to do a self-exam is usually a week after your period, when your breasts are less tender. Stand in front of a mirror, hands on your hips, and really look at your breasts. Are they symmetrical? Any changes in size or shape? Then raise your arms and check again. Finally, lie down and feel your breasts in a circular motion, using light, medium, and firm pressure. Now let's talk lumps and bumps. I know this is what everyone worries about, and it's understandable. Most lumps are benign, meaning they're not cancerous, but you should always get any new lump checked by a doctor. Don't try to diagnose yourself. We're not talking about squeezing a pimple here. A lump might feel like a hard pea or a grape under the skin, and it can be movable or fixed. Again, no two breasts are the same, so you need to know what's normal for you. If something feels off, get it checked out. Breasts can change size and shape throughout our lives, and that's totally normal. Hormonal fluctuations, pregnancy, weight gain or loss, all these things can affect our breasts. But if you notice a sudden or dramatic change in one breast, that's something to pay attention to. For example, if one breast becomes noticeably larger or smaller than the other, or if the shape changes significantly, talk to your doctor. It's always better to err on the side of caution. Chapter 4. Let's talk about something called skin dimpling or puckering. This is when the skin on your breast looks like the surface of an orange peel, and it can be a sign of inflammatory breast cancer. This type of cancer is rare but aggressive, so it's crucial to catch it early. Now, dimpling doesn't always mean cancer. It could be caused by other things, like an infection or even just normal skin changes. But again, it's not worth the risk. If you notice any dimpling or puckering, see your doctor right away. Chapter 5. Nipple discharge. Not just a breast milk situation. Nipple discharge is common, especially during pregnancy and breastfeeding. But if you're not pregnant or breastfeeding and you notice any discharge, it's important to get it checked out. The discharge could be clear, milky, yellow, green, or even bloody, and it might come out on its own, or only when you squeeze your nipple. Again, this doesn't automatically mean something is wrong, but it's always best to be safe and get it looked at. Chapter 6. Redness or flaky skin. Pay attention to your nipples. Now let's talk about the delicate skin around our nipples. If you notice any redness, flakiness, or scaling on your nipple or areola, don't ignore it. It could be a sign of a common skin condition like eczema or dermatitis, but it could also be a sign of Paget's disease, a rare type of breast cancer. Paget's disease often starts with changes in the skin of the nipple and areola, so it's important to be aware of these changes. Chapter 7. Breast pain. Don't suffer in silence. Finally, let's talk about breast pain. Many women experience breast pain at some point in their lives, and it can be caused by a variety of factors, including hormonal changes, cysts, and even certain medications. However, if you experience persistent breast pain, especially if it's localized to one specific area, it's important to see your doctor. While most breast pain is not caused by cancer, it's essential to rule out any serious causes and get the appropriate treatment. Outro. Be breast aware, stay healthy. If you notice any of these signs, please consult with your healthcare provider as soon as possible. Early detection is key. Remember, knowledge is power when it comes to our health. We need to be our own advocates and pay attention to what our bodies are telling us. Don't be afraid to ask questions, get second opinions, and do what's right for you. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy.